Welcome students. Let us continue with the chapter 5, that is therapeutic approaches. So students, today we are going to cover the most important therapy in psychology, that is behavior therapy. So today we are going to understand what is behavior therapy, the method of treatment, and the range of behavioral technique available for changing behavior. So let us continue. Students, let us try to understand first what is behavior therapy. So as it is very clear with the name that behavior therapy focuses primarily on the observable behavior. It corrected the faulty behavior or the maladaptive behavior and try to replaces it with the corrected behavior or adaptive behavior. So this theory is of the view that psychological distress arises because of the faulty behavior pattern or thought pattern. So this therapy focuses more on the present faulty behavior or thought patterns of the client, whereas the other therapy like psychodynamic therapy or the humanistic existential therapy focuses primarily on the insight, but this therapy focuses primarily on the correction of the behavior. So the past is relevant only to understand the origin of the faulty behavior or the thought patterns. Behavior therapy uses the principle of or apply the principle of learning like classical conditioning or print conditioning or instrumental conditioning or observational learning. So students, as you know, there are various techniques of behavioral therapy available for changing behaviors. The different therapies, so the which therapy the therapist will use, it will totally depend upon the clinical diagnosis or the symptoms present in the client. So for example, treatment of phobias or fears would require the use of one set of technique, while that of anger outburst would require another. A depressed client would be treated differently from a client who is anxious. So, students, the foundation of behavioral therapy is on formulating faulty behavior or dysfunctional behavior, then to identify factors which reinforce and maintain these behaviors, and then finally devising methods by which these behaviors or faulty behaviors can be changed. So students, our next subtopic is method of treatment under behavioral therapy. So students, it all begin with interviewing the client, the person who is facing psychological distress or physical symptoms which totally can't be attributed to the physical disease is firstly interviewed. Then the client is analyzed. The client's behavioral patterns are analyzed and behavioral analysis is conducted, especially to find the malfunctioning behaviors, the antecedent, and the factors that maintain or continuing faulty learning. So let us try to understand first what are malfunctioning behaviors. So students, malfunctioning behaviors are those behaviors which cause distress to the client or the behaviors which are upsetting to the clients or to the others. And next is antecedent factors. So those factors which are preceding the behaviors or the immediate factors before the occurrence of the behavior. Next is maintaining factors. So students, maintaining factors are those factors which are continuing the faulty behaviors. So students, let us try all three things by one example. A student or a young person who has acquired the malfunctioning behavior of smoking and seeks help to get rid of smoking. So firstly, the behavioral analysis is conducted by interviewing the client and the family also. So smoking, we learned that the person started smoking when he was preparing for the annual examination. So he had a reported relief from anxiety upon smoking. So students, anxiety provoking situation would be the antecedent factors or the cause of the faulty behavior. Then the client had acquired the acquired the reinforcing value, that means the relief upon smoking. So the relief upon smoking would be the consequent factors or the maintaining factors. So students, then the smoking itself is a behavior. So I hope from this example now it is very clear what is malfunctioning behavior, antecedent factors and maintaining factors. Next, after identification of the faulty behaviors, the treatment package is chosen. The aim of the treatment is to eliminate the faulty behavior and substitute them with the adaptive behavior patterns. So students, therapists achieve this aim, or they does this through establishing two operations. One is antecedent operation and another is consequent operation. So what are antecedent operation? From the term antecedent means the preceding factors or the factors before the occurrence of the behavior. So antecedent operation would be the operations which we use or which we apply before the actual behavior or before the occurrence of the behaviors. That means here the antecedent factors, antecedent operation would be controlling something which precedes the or which leads to the malfunctioning behavior, and the consequent operation would be those operations when the person or the client is indulging in the desirable behavior like praising the client. So let us try this with one example. For like a child gives trouble to the parents in eating dinner. So here we are using two operation, antecedent and consequent operation. So after a behavioral analysis, we learned that the child had enough for a child had enough during the tea time. So that is the main reason that he do not take his dinner. So so that means the antecedent operation, how we apply here antecedent operation, we would reduce the food at the tea time, and this would increase the hunger at the dinner, and the consequent operation would be praising the child when he was actually eating dinner, or praising the child or encouraging the child when he or she eats properly. So this is how this establishes the response of the eating dinner. So students, our next subtopic is behavioral techniques. So there are various technique, a range of techniques available for changing behavior or for behavioral modification. So in behavioral therapy, we use various principles from learning theories, like the famous learning theories are classical conditioning, operant conditioning and vicarious learning, that is learning from observation, learning by observation. So we have negative reinforcement, positive reinforcement, punishment. Again we have positive punishment and negative punishment, which we try to understand thoroughly. So first is we have positive reinforcement. Positive reinforcement means, see, positive reinforcement and negative reinforcement both are given to strengthen the desired behavior. For example, positive reinforcement is adding the stimulus after the desired response or after the desired behavior pattern. For example, like praising the child after writing, after good handwriting, or praising the child after doing the dishes. So this is an example of positive reinforcement. Then the negative reinforcement would be uh, um, removing something which is unpleasant to the client or which is unpleasant to the person. So by just removing it, it is known as negative reinforcement. For example, removing the restrictions or eliminating the restrictions if the child follows the rules. So this can be the example of negative reinforcement. Then we have punishments. Under punishment we have positive punishment. Positive punishment, again, adding some. So positive reinforcement means adding some unpleasant stimulus after the behavior, for example. But one things to keep in mind, that the difference between punishment and reinforcement is that reinforcement therapist always gives reinforcement to encourage the behavior, to encourage the desired behavior, and punishment is given to discourage the undesired behavior. So positive reinforcement means adding the stimulus, or especially the unpleasant stimulus, to discourage the unpleasant behavior. For example, like yelling at the child when he throws tantrums, and it can be giving extra homework to the child when he doesn't complete his homework. And then the negative punishment would be removing something, removing, we can say, removing the pleasant thing from the child after showing the undesired behavior. For example, like child's cards or collected cards are taken away if he or she shows or shouts at the mother, or shouts at the elder. So these types of reinforcement and punishments are mostly used for shaping the behavior of the child, or shaping the desired behavior, or discouraging the undesired response pattern. So next principle we use for behavioral modification from classical conditioning is aversive conditioning. So aversive conditioning is a repeated association of undesired response with an aversive consequences. That means if a response is followed by pain or punishment, its strength should be weakened. So in practice, chronic alcoholics have been treated by this technique. A nausea producing drug is mixed into an alcoholic drink, so that drinking over a period of time, or so that drinking leads to sickness and vomiting. After a number of such trials over a period of time, the sight of the drink alone may lead to nausea. The technique had been used to treat a variety of problems like overeating, heavy smoking, sexual perversions, and drug and alcohol abuse. So the next technique we have under behavioral therapy is token economy. So this technique has been used to establish adaptive behavior ranging from eating behavior in children to institutionalized psychotic patient. A token instead of money is paid for the work, and later the token can be exchanged for the desired objects or activities. These steps are involved in these techniques, like designate the behavior felt to be desirable and hence to be reinforced. Second, a medium of exchange is established. A token can be a card or a clip. Then backup reinforcers are decided. They may be a movie show, some special foods, or a picnic. So accumulation of certain number of tokens can be traded for any one of these. For example, let's say 15 tokens, maybe 20 tokens. So the goal of a token program are to develop desirable behavior that will lead to social approval from significant others, like from parents, peer group, friends, and to develop necessary skills in the individual. The person learns that he can control his own environment in a way which will elicit positive reinforcement from others. So that is all about token economy. So students, next we have systematic desensitization sessions. So in these sessions, the patient is presented with or asked to visualize the least anxiety producing item. So while she is in a relaxed state, after some time, the therapist moves on to the next most disturbing stimulus on the hierarchy, and then on the next situation up to the highest level of anxiety producing stimulus. So, this process is continued until the patient asks to stop due to the overwhelming anxiety producing situation. After several sessions, the patient is generally able to visualize anxiety at the highest level of hierarchy. The treatment continues by repeating this process. So this is all about systematic desensitization. So the next technique we have is modeling technique. In children, an important part of learning is based on watching and imitating others. So Bandura has worked extensively on developing the modeling technique. Modeling can influence behavior as it serves as a basis for learning new skills, to eliminate fears and inhibitions, and to facilitate socially existing behavior patterns. So it's a procedure wherein the children learns to behave in a certain way by observing the behavior of a role model or the therapist who initially acts as the role model. So vicarious learning, that is the learning by observing others, is used, and through a process of rewarding small changes in the behavior, the client gradually learns to acquire the behavior of the model. So the next is the principle of reciprocal inhibition. So this principle states that the presence of two mutually overlapping opposing forces at the same time inhibit the weaker force. In other words, one cannot be both relaxed and anxious at the same time. So thus the relaxation response dominates on the imagination of mild anxiety provoking stimulus. So the client becomes able to tolerate progressively greater level of anxiety because of his or her relaxed state. So this is all about the techniques of behavioral therapy.